Skin hyperpigmentation is one of the most common skin conditions today worldwide, and it is not only stubborn to treat, but it can be overwhelming finding the right skincare ingredients to treat the excess pigment in the skin. To understand how to treat hyperpigmentation, we first need to understand melanin. Melanin is the pigment responsible for the color of our hair, eyes, and most importantly, skin. It's produced by cells called melanocytes. When these melanocytes get overactive due to factors like UV radiation, hormonal changes, they can produce excess melanin, causing patches of skin to darken. That's hyperpigmentation. Now, UV-induced pigments such as sunspots and freckles are superficial and present in the upper layers of the skin known as the epidermis. The degree of the pigmentation depends on how much UV light the melanin pigments are exposed to. Post-inflammatory hyperpigmentation is a response to injury of the skin and can be a result of acne, burns, friction, or aggressive skin clinical treatments such as chemical peels, laser, and incorrect waxing. This condition resolves with time but responds well to the right skincare ingredients. And finally, melasma, also known as the pregnancy mask, is a pigmentation that is deeper within the skin, the dermis. It has been linked to hormonal imbalances and can be made worse with UV exposure, pregnancy, medications, and stress. With the correct treatments and home care, it can be reduced and maintained. Now, what creates melanin, the pigment within the skin, is cells called melanocytes. An enzyme called tyrosinase is what communicates with the melanocytes to create more pigment to protect your skin. When it comes to choosing the correct skincare ingredients to treat hyperpigmentation, the best options are tyrosinase inhibitors that stop the communication to the melanocytes, and also ingredients that prevent the transfer of pigment from the melanocyte to the keratinocyte in the epidermis. Now, the first skincare ingredient we recommend for you to have in your skincare routine is niacinamide, also known as vitamin B3. Niacinamide is a multitasker skincare ingredient and water-soluble vitamin that is suitable for all skin types and skin conditions. Niacinamide works at both reducing and preventing hyperpigmentation, as it is a tyrosinase inhibitor, ensuring each cell is not holding onto too much pigment. But it also prevents the transfer of pigment from the melanocyte to the keratinocyte within the epidermis. The next skincare ingredient is retinol, also known as vitamin A. Vitamin A is a targeted night treatment to help with skin renewal and can affect DNA change within the cell. So this is perfect to help treat hyperpigmentation. Vitamin A is best to be used at nighttime when our skin goes into repair mode. When you begin to use vitamin A topically on the skin, it does work on the top layer of the epidermis first. It works at speeding up cell turnover and removing any dead skin cells that aren't meant to be there anymore. So it is normal for your skin to go through a phase of being dry and flaky when you begin to use vitamin A. Once it goes through this phase, the skin becomes a lot more smoother and softer, and your active ingredients can penetrate deeper within the skin to alive cells. Vitamin A travels down the epidermis, the top layer of the skin, and interacts with the melanocytes, which create pigment within the skin. When melanocytes are damaged, they can produce excess pigment in the skin, giving our skin excess pigmentation or post-inflammatory scarring, which can occur with acne or damage to the skin. Vitamin A will work at correcting and balancing the melanocyte so it is functioning normally. Vitamin A is also a tyrosinase inhibitor, reducing excess pigment within the melanocyte. It can make your skin more sensitive to UV radiation, so ensure that you use vitamin A at nighttime, and then you need to use sun protection during the day. If you are pregnant or breastfeeding, you want to avoid vitamin A. The next ingredient is ascorbic acid, also known as vitamin C. This ingredient is an amazing antioxidant which will shield against free radical damage. Free radicals cause cellular damage to the skin, causing our skin to not function properly. Vitamin C is also a tyrosinase inhibitor, which is what allows our melanocytes to release pigment into the skin. So when you're using vitamin C topically on the skin, it not only ensures your skin isn't producing excess pigment, but it works at reducing the pigment present. Now, do keep in mind that vitamin C can be stimulating at first, so it's best to introduce the ingredient slowly, just a few times a week, and then build up to every single morning. Niacinamide and vitamin A don't get on with vitamin C, so if you do start introducing vitamin C into your routine to help with your hyperpigmentation, use it in your morning skincare routine, and then use niacinamide and vitamin A in the evening routine. Now, finally, lactic acid. Lactic acid is an alpha hydroxy acid, which is a water-soluble chemical exfoliant that works on the skin like a Pac-Man effect to exfoliate and remove dead skin cells. Regular exfoliation will help with superficial pigmentation located within the epidermis, that top layer of the skin, and also help your other ingredients absorb deeper within the skin. Lactic acid is gentle for all Fitzpatrick skin types and can be used a few times weekly at nighttime underneath your moisturizer. Niacinamide and retinols should never be mixed with acids, so we do recommend using these ingredients on alternating nights to the alpha hydroxy acid and before your moisturizer. So if you do decide to use all of these ingredients in your skincare routine to treat or help with hyperpigmentation, then this would be the perfect skincare routine for you for both morning and evening. We do recommend high quality skincare products for best results. In the morning, use the following. Start by cleansing the skin, apply a vitamin C serum, moisturizer, and sunscreen. In the evening, 5 times per week, double cleanse your skin, apply a retinol or vitamin A serum, then you can apply a niacinamide, and then moisturizer. If your vitamin A or retinol is an oil base, just use your water-based serums first. So ensuring that you do then just switch it around and apply niacinamide, then retinol. It'll depend if your retinol is either oil-based or water-based. And then in the evening, 2 times per week, double cleanse and then apply an AHA lactic acid serum and apply that one to the skin and then finish with a moisturizer. So that lactic acid serum should be a leave-on serum so you can get the best results and it's able to work efficiently on your skin. As usual, you should always make sure that you patch test any new products to ensure that you don't have any reactions. 70% of your skin results come down to the correct home skincare routine. So these are the exact skincare ingredients you should include in your routine if you are trying to treat any form of hyperpigmentation. Now, for stubborn hyperpigmentation, advanced professional skin treatments depending on your Fitzpatrick type and the form of hyperpigmentation to accelerate your results are chemical peels, microneedling, and Cosmelan peel. If you want to learn more about hyperpigmentation, definitely check out these videos here next.